Good evening. Tonight, I want to talk about an organ that performs over 500 distinct functions inside your body every single day. An organ that filters your blood, produces proteins essential for clotting, metabolizes every medication you take, regulates your cholesterol, stores energy, and supports your immune system, all simultaneously, all without any sensation whatsoever that would tell you when something is going wrong. I'm talking about your liver. And what concerns me deeply after more than 2 decades working with adults over 65 is how consistently liver health gets overlooked in older adults until the damage has already become significant. I'm Dr. Will Graham, and tonight I'm going to walk you through 5 signs your liver may be struggling right now. Signs that are almost universally attributed to something else entirely. Signs that, if recognized early, give you and your physician a genuine opportunity to intervene before irreversible damage has occurred. Here's a statistic that genuinely surprised me when I first encountered it. Research published in the journal Hepatology estimates that non-alcoholic fatty liver disease, the most common form of liver disease in older adults, affects approximately 35 to 40% of adults over the age of 65 in Western countries, making it one of the most prevalent chronic conditions in this age group. Yet liver function is not routinely tested in most annual checkups unless specifically requested, and the early stages of liver decline produce symptoms so vague and easily misattributed that most people never connect them to their liver at all. Here's what makes liver health particularly critical to understand after 65. Your liver is responsible for metabolizing the medications you take, and the average adult over 65 in the United States takes 4 or more prescription medications daily, according to research from the National Institute on Aging. When liver function declines, medication metabolism slows, meaning drugs can accumulate in your system at higher concentrations than intended, potentially causing side effects or toxicity that gets blamed on the medications themselves rather than on the liver's reduced ability to process them. Understanding your liver's functional health is not just about the organ itself. It directly affects how safely and effectively every treatment you receive actually works. Stay with me through all 5 signs tonight because the fifth one involves a symptom that virtually nobody connects to their liver, yet it has one of the most direct, well-established biological explanations of anything we'll discuss this evening. Before we dive in, drop a comment below and tell me your age and whether you've had a liver function panel included in your blood work recently. I read every single comment on this channel, and I respond to as many as I genuinely can. Alright, let's count down from 5 to 1. Number 5. Persistent fatigue and a general sense of malaise that doesn't improve with rest. I recognize that fatigue appears on almost every list we've covered on this channel, from B12 deficiency to magnesium, thyroid dysfunction, kidney disease, and heart failure. I bring it up again tonight because liver-related fatigue has its own distinct biological mechanism worth understanding separately, even if on the surface it feels similar to these other causes. Here's what makes liver-related fatigue unique. Your liver plays a central role in glycogen storage and release, meaning it regulates the steady supply of glucose your muscles and brain depend on for sustained energy throughout the day. When liver function declines, this regulatory process becomes less reliable, leading to energy fluctuations that feel different from ordinary tiredness. Patients describe it as a deep, bone-level exhaustion that doesn't follow normal patterns, feeling disproportionately drained after minimal activity, or experiencing sudden energy crashes mid-afternoon that feel completely unrelated to how well they slept or how much they ate. Beyond energy regulation, your liver produces albumin, the primary protein responsible for maintaining fluid balance in your tissues and transporting hormones and nutrients through your bloodstream. When liver function declines, albumin production can drop, affecting the efficient delivery of energy substrates throughout your body, further compounding that pervasive, hard-to-shake sense of exhaustion. Research published in the Journal of Hepatology found that fatigue was the most commonly reported symptom among adults with early-stage liver disease, present in a substantial majority of patients, and critically, that fatigue severity correlated directly with objective measures of liver function decline even at relatively early stages, well before other more classically recognized liver symptoms appeared. This positions fatigue as a potentially valuable early warning indicator that deserves investigation rather than simple reassurance. A 72-year-old retired pharmacist came to me describing profound afternoon fatigue that had been worsening gradually over 8 months. Given her background, she had already ruled out several obvious causes herself. A comprehensive blood panel, including liver function tests, revealed elevated liver enzymes consistent with early non-alcoholic fatty liver disease. Addressing her dietary patterns and reviewing her medication regimen with this new context led to measurable improvement in her liver function markers over the following months, alongside a meaningful return of her energy levels. Number 4. Unexplained skin changes, including persistent itching, unusual bruising, or a yellowing tint in your skin or the whites of your eyes. Skin changes connected to liver function tend to appear at different stages of liver decline, which is why I'm grouping several together here while distinguishing between their different levels of urgency. Let's start with persistent itching, medically called pruritus, which can be one of the earliest, most overlooked signs of liver stress. When your liver's ability to process bile acids becomes impaired, these compounds can accumulate in your bloodstream and deposit in your skin tissue, triggering a persistent, sometimes intense itching sensation that has no obvious external cause. Patients describe it as an itch that doesn't respond to moisturizers, antihistamines, or any topical treatment because it originates internally rather than from any surface-level skin condition. Research published in the Journal of the American Academy of Dermatology identified unexplained generalized pruritus, particularly without any visible skin rash, as a recognized early indicator of underlying liver or bile duct dysfunction in older adults, and noted that it was frequently attributed to dry skin or allergic reactions for months before a hepatic cause was investigated. Unusual bruising represents a somewhat more advanced warning. Your liver produces the majority of clotting factors your blood depends on to form clots when you're injured. When liver function declines, clotting factor production can become impaired, leading to bruising that appears more easily and extensively than you would expect from minor contact. If you've noticed yourself bruising from impacts that never used to leave a mark, or bruises that seem disproportionately large or slow to resolve, this deserves specific attention rather than simple attribution to blood thinners or thin skin that comes with aging. Yellowing of the skin or eyes, called jaundice, represents a more advanced sign requiring prompt medical attention. It occurs when bilirubin, a waste product normally processed and excreted by your liver, begins accumulating in your bloodstream and tissues. Any noticeable yellowing, however mild, warrants same-day or next-day medical evaluation rather than a wait-and-see approach. Number 3, digestive discomfort, nausea, or a noticeable loss of appetite, particularly for fatty or rich foods. This sign overlaps significantly with our recent video on gut health, which is precisely why liver-related digestive symptoms so frequently go uninvestigated as a potential hepatic issue. But the mechanism here is distinct from gut microbiome dysfunction, and understanding that distinction matters for identifying the right approach. Your liver produces bile, a digestive fluid stored in your gallbladder and released into your small intestine to help break down dietary fats. When liver function becomes impaired, bile production and flow can become less efficient, leading to difficulty digesting fatty foods specifically, manifesting as nausea, bloating, upper abdominal discomfort, particularly on the right side beneath your ribs, or a general aversion to foods you previously enjoyed without difficulty. Many older adults describe gradually shifting away from foods they used to love, rich meals, fried foods, or even full-sized portions generally, without ever identifying why these foods now reliably make them feel uncomfortable. They adapt their diet around the discomfort without recognizing it as a symptom rather than simply a natural shift in taste or appetite with aging. A study published in the journal Alimentary Pharmacology and Therapeutics found that right upper quadrant discomfort and dietary fat intolerance were among the most commonly reported digestive symptoms in adults with confirmed non-alcoholic fatty liver disease, appearing frequently in the early stages before any significant elevation in liver enzyme markers was detectable on standard blood tests. This finding is particularly significant because it suggests that these symptoms can appear before conventional blood testing would flag a problem, making patient-reported symptoms an important early diagnostic tool that deserves careful attention rather than dismissal. I recall a 69-year-old retired restaurant owner who told me with some irony that he, having spent 40 years cooking rich, elaborate meals, now found himself completely unable to eat the foods he'd spent his career preparing without feeling genuinely unwell afterward. He'd assumed this was simply his digestion winding down with age. A liver ultrasound revealed significant hepatic steatosis, fatty liver disease, that had been silently progressing for years while he simply adjusted his diet around the growing discomfort. Quick note here, if this information is proving valuable, take a moment to subscribe to this channel because every week we cover exactly this kind of detailed, research-backed health information that a brief standard appointment often simply doesn't have time to fully address. Number 2. Cognitive changes, including difficulty concentrating, mental fogginess, or unusual sleep pattern disruptions. This sign creates significant diagnostic confusion because cognitive symptoms in older adults are so readily attributed to aging, stress, or the early stages of neurodegenerative conditions that a hepatic contributing factor almost never enters the clinical conversation unless liver disease has already been formally identified. Here's the mechanism that makes this connection so important. When your liver's ability to filter toxins from your bloodstream becomes impaired, certain waste products, particularly ammonia, can accumulate at levels that directly affect brain function, Your liver is your body's primary ammonia-clearing organ, converting it to urea for safe excretion through your kidneys. When liver function declines, even modestly, this ammonia clearance can become less efficient, and even mildly elevated ammonia levels have been shown in research to impair cognitive clarity, attention, and sleep architecture. This condition, in its more advanced clinical presentation, is called hepatic encephalopathy, but research increasingly suggests that subclinical or minimal hepatic encephalopathy, a milder version that doesn't reach the threshold of obvious clinical diagnosis, is far more common in older adults with early-stage liver disease than previously recognized, and that its effects on daily cognitive function can be meaningful even when they don't meet formal diagnostic criteria. A study published in the journal Liver International found that adults with early-stage liver disease performed measurably worse on standardized tests of attention, processing speed, and working memory compared to age-matched controls without liver disease, and that these differences were significantly correlated with ammonia clearance efficiency rather than simply with age or other confounding factors. Separate research from the same journal identified sleep disturbances, particularly disrupted sleep-wake cycles and excessive daytime sleepiness, as an early manifestation of subclinical hepatic encephalopathy in adults with otherwise mild liver disease. This is why cognitive symptoms appearing alongside any of the other signs we've discussed tonight should prompt a conversation about liver function specifically, rather than defaulting immediately to a purely neurological explanation. And now, number 1, unexplained weight changes alongside visible abdominal swelling or a sensation of fullness and pressure in your abdomen. This is the sign I consider most clinically significant tonight because it can represent a meaningful shift in liver disease severity and deserves prompt rather than delayed medical evaluation, while simultaneously being one of the signs most consistently attributed to ordinary digestive patterns, dietary changes, or simply middle-age spread that many older adults have accepted as unremarkable for years. Here's the biology. When liver disease progresses beyond early-stage dysfunction, the liver can begin developing scar tissue through a process called fibrosis and, in more advanced stages, cirrhosis. As this scarring develops, it increases resistance to blood flow through the liver, raising pressure in the portal vein, the large blood vessel delivering blood from your digestive organs to your liver, a condition called portal hypertension. One of the consequences of portal hypertension is the accumulation of fluid within the abdominal cavity itself, a condition called ascites. This fluid accumulation can be subtle in early stages, presenting as a gradual increase in abdominal girth, a persistent sensation of fullness or pressure, or clothes fitting tighter around the midsection in a way that doesn't seem proportionate to any change in eating habits. Many patients attribute this to bloating, constipation, or general weight gain without ever considering a hepatic origin. Beyond ascites, weight changes in liver disease can be genuinely paradoxical and therefore confusing. Muscle wasting associated with impaired protein synthesis and nutrient processing can cause actual body weight to decrease even as abdominal fluid accumulation causes your waistline to simultaneously increase, creating a pattern of losing weight elsewhere while gaining apparent girth in your midsection that feels contradictory and is therefore often dismissed as simply inconsistent or confusing rather than recognized as a meaningful clinical pattern. A study published in the journal Gut found that abdominal symptoms, including distension, a sensation of fullness, and subtle early ascites, were frequently present for 6 months or longer before a formal liver-related diagnosis was made in older adults, most commonly because the symptoms had been attributed to dietary factors, irritable bowel patterns, or general age-related changes in digestion throughout that period. A 75-year-old retired accountant came to me after his wife noticed his abdomen seemed visibly larger over a period of several months, despite the fact that he had actually lost weight overall and had no increased appetite to explain the change. He'd been attributing the abdominal fullness to a dietary sensitivity he'd been trying to identify through elimination. An abdominal ultrasound revealed early cirrhosis with beginning ascites formation. Identifying this at that stage allowed for immediate intervention and specialist referral before the condition progressed to a more critical point. If any of these 5 signs sounded familiar tonight, persistent unexplained fatigue, skin changes including itching or unusual bruising, digestive intolerance, particularly to fatty foods, cognitive fogginess or sleep disruptions without clear explanation, or abdominal swelling and unexplained weight changes, I want to genuinely encourage you to ask your doctor specifically for a liver function panel, including ALT, AST, alkaline phosphatase, bilirubin, and albumin levels, alongside an abdominal ultrasound if any of these symptoms are present. These are inexpensive, widely available tests that provide a remarkably comprehensive picture of your liver's functional health, yet they are not always included in a standard annual checkup without a specific request. Lifestyle factors worth discussing with your physician include dietary patterns, specifically reducing added sugars, refined carbohydrates, and processed foods, which are among the primary drivers of non-alcoholic fatty liver disease, alongside a comprehensive review of every medication and supplement you currently take, since medication-induced liver stress is significantly more common in older adults than many people realize. All of the research referenced tonight from the journal Hepatology, the Journal of Hepatology, the Journal of the American Academy of Dermatology, Alimentary Pharmacology and Therapeutics, Liver International, and the journal Gut are linked in the description below. I encourage you to review them and bring them with you to your next appointment. If you found tonight's video valuable, please subscribe to this channel because every week I bring you exactly this kind of thorough, research-backed health information specifically relevant to adults over 65, the kind of detailed explanation a rushed standard appointment often simply doesn't have time to provide. Now, I genuinely want to hear from you. Tell me in the comments which of these 5 signs resonated most with your own experience, and whether you've ever had your liver function specifically tested as part of your routine care. I read every single comment, and your story might be exactly what prompts someone else watching tonight to ask the question at their next appointment that finally gets them real answers. Take good care of yourself tonight. Your liver has been quietly doing extraordinary work for you every single day. It deserves your attention, and it deserves it before problems become impossible to ignore. I'll see you in the next one.